Are you dealing with knee pain? Wondering, is my knee shot? Am I going to have to get it replaced? Like, what is going on with this thing? And so, the knee itself is a joint, it's a hinge joint, and a lot of times knee pain is actually not in the knee itself. Now, I get that the pain can be around the knee, but a lot of times it's actually the soft tissue that's around the knee, and it's not the joint that's the problem. It is different muscles that might be attached, might be tendons in there that might be causing the pain, and the pain itself is not caused by the knee joint, but something around the knee joint. And the knee problem, that pain around the knee joint, is actually not caused by the knee itself either, that it's coming from somewhere else. A lot of times we'll see that it's coming from either your hip or it might be coming from your ankle. And a lot of times we'll see this, is that this muscle right here, or there's a group of muscles called the glutes, the glute medius, the glute minimus, and even the glute maximus can be weak. And what happens is it actually creates a collapse of the knee. And so the technical term is a valgus to the knee. And so if you've ever heard of people being knock-kneed, like their knees come in like this, okay? That would be a valgus to the knee. But it can happen just on one side. And so you might see that that knee collapses because this muscle right here is weak, or the ankle, maybe there's a dropped arch due to a weakness, or maybe because the feet just don't have the stability that they need. And so when I look at someone with a knee problem, I don't just look straight at the knee, I look at the rest of the body. Now, what if this is weak? I want to show you a couple of really easy exercises that you can do to strengthen the glutes. The first thing I always do is assess, well, is that glute weak, or maybe there's something else going on? Is it weak compared to the other side? A simple test that you can do is to do a one-legged bridge. So when you do a bridge, you bring your pelvis up like this first. You kind of tilt the pelvis, come up like this. Then a one-legged bridge would be you straighten out the leg like this. And then you're going to see, is the person shaking, or if you're doing it on yourself, do you find that, whoa, I'm really shaking hard here? Do you find that your hip comes down like this? Do you find that you got to bring your leg over to get that, be able to hold your leg up? Do you find that you're starting to rotate your pelvis like this, okay? So you test side to side, and you might see, well, this side's a lot harder than this side, okay? You have a weakness in the glute then, okay? One way to strengthen that is to do a bridge, a banded bridge. And so what you're going to do is you're going to take this band, you're going to put it onto your legs like this. This is a pretty tight one, but you'll see that they're actually pretty strong muscles, even though one might be weak. You're going to come up like this, and then you're going to just push your pelvis out, and you will really feel that in those muscles, okay? Then I hold it. This is what we call an isometric contraction. Now you can come and do reps where you come up, come out, push out, come back down, come up, push out. Now those would be reps, okay? Not as much of an isometric contraction. Another thing you can do is just a side lateral shuffle. So you squat down like this. Don't want to go like this forward. You want to sit down like you were sitting into almost like a squat or a sitting position or a wall sit, if you've ever done that. Hold it like this, and then you're going to go sideways like this. You're going to go both directions, okay? So those are going to strengthen your glutes. And what that can help with is that knee pain that's caused by a valgus to the knee, or a collapse of the knee because of weakness in the glute. Hopefully this is helpful. Again, this can be really helpful to know if your knee pain is coming from your pelvis. Again, do that one-legged bridge, do the strengthening to correct the problem, and then the knee pain. Hopefully it will go away. Sometimes the knee actually does need to be treated just because there's so much inflammation from that weakness on that one side. But a lot of times just doing that can get rid of the pain completely. So again, my name is Dr. Aaron Moreland. I'm with Vallejo Health and Wellness Center in Eden Prairie. Hopefully you're having a great day, and hopefully this is helpful. God bless.